The HPMV outbreak in China has raised significant concerns about its potential to escalate into a pandemic. HPMV, or High Pathogenicity Mycoplasma Virus, primarily affects livestock, but its rapid spread among animals risks food security and public health. The virus has shown an alarming ability to mutate, making it difficult to contain. Farmers are facing devastating losses, and the government is implementing strict measures to control the outbreak. HPMV stands for High Pathogenicity Mycoplasma Virus, which is often associated with diseases in animals, particularly poultry. However, there's a slight discrepancy. The more common term related to serious outbreaks in animal populations, particularly avian, is highly pathogenic avian influenza, HPAI, or Mycoplasma gallisepticum. HPMV, human metapneumovirus, outbreak can be a significant concern. HPMV is a respiratory virus that can cause symptoms similar to those of the flu, cold, or even respiratory infections like pneumonia or bronchitis, particularly in vulnerable populations like young children, the elderly, and those with weakened immune systems. Outbreaks of HPMV can lead to increased hospitalizations, especially in vulnerable individuals, and may strain healthcare resources. It's also a concern because, like other respiratory viruses, it can spread easily through droplets from coughing, sneezing, or close contact, which could lead to rapid transmission in communities or healthcare settings. Economic consequences. HPAI outbreaks can lead to significant economic losses in the poultry industry due to high mortality rates in infected birds, costs of culling infected flocks, and biosecurity measures. Export bans may also be implemented, further impacting trade. Public health concerns. While HPAI primarily affects birds, certain strains can infect humans, raising public health concerns. If those cases arise, they can lead to significant health risks and necessitate rapid response measures. Food security. The loss of poultry due to outbreaks can negatively impact food supplies, particularly in regions heavily reliant on poultry as a protein source. Biosecurity and surveillance. HPAI outbreaks lead to increased emphasis on biosecurity protocols in farms, surveillance in wild bird populations, and research into vaccines and treatments for at-risk populations. Ecological impact. Outbreaks can lead to the death of large numbers of wild birds, disrupting local ecosystems and potentially leading to changes in species distributions. Monitoring and managing such outbreaks would typically involve increased surveillance, public health interventions, and in some cases, vaccines or antiviral treatments if available. Preventive measures like good hygiene, wearing masks, and avoiding close contact with infected individuals can also help reduce the spread. Experts warn that if HPMV jumps to humans, we could see a new wave of health crises. Vigilance is crucial. Monitoring, research, and swift action are our best defenses. The world is watching closely as we navigate this precarious situation.